In comparison to a hospital setting, children tend to really appreciate the small size. In addition, we use less medication in treating a child to go back to the operating room. We focus more on getting the child comfortable with the people they're with in order to help them go back to the operating room comfortably. By using less medication up front, children wake up faster, they're able to leave the surgery center and get back to their home environment faster.
The question usually is, does this person need surgery for their thyroid gland or not? And that's a difficult question to answer because there's so many different problems you can have with the thyroid. Some of them are treated non-surgically with medicine, and some of them are treated surgically. And so we work hand in hand often with internists, family medicine doctors, and endocrinologists to decide when it's appropriate to do surgery for a patient versus when it's appropriate to treat medically.
Some of the signs and symptoms of pediatric sleep apnea include snoring, waking up frequently in the middle of the night with sounds of like choking, gasping for air. Enuresis, also known as bedwetting, is also a frequent symptom. Because they aren't sleeping well during the night, this can also lead to inattentiveness and hyperactivity during the day while they're in class, and some children have often got misdiagnosed with attention deficit disorder, when in fact, if you look closely at their history and their symptoms, they actually have sleep apnea.
I find that people, after having had their tonsils out, will notice that they have more energy, that they breathe better through their noses, that their general overall sense of well-being is enhanced by having had their tonsils out.
When Central Park Surgery Center was originally built about 9 years ago, it was primarily ear, nose, and throat. And so the whole place was designed around the idea of the flow of the ear, nose, and throat surgical case. And this allows us to tailor the pre-op, the intra-op, and the post-op experience to ear, nose, and throat patients, to children and to adults as well. And I think that makes it safer and more effective and a more pleasant experience as well. It also allows us to control price from start to finish, which is very unique in this market. And I think that is one of the reasons why we are probably least expensive, or one of the least expensive facilities in the area when it comes to this kind of surgery.